Good evening. This is All India Radio, Kohima. I'm Jonas Yantan with Evening News. The headlines. Health Ministry revises national policy for admission of COVID patients to various categories of COVID facilities. Drugs Controller General of India approves drug developed by DRDO for emergency use in treatment of COVID-19 patients. Prime Minister Narendra Modi participates in a meeting of the European Council. And Nagaland Chief Minister Neiphiu expresses gratefulness to Red Cross members and volunteers, especially those fighting COVID-19 pandemic. As the number of COVID cases are on the rise, we appeal to our listeners to take all the precautions and all those above 18 years of age to get vaccinated without any hesitation. Stay safe and protected by following these 3 simple steps. Wear a face mask, focus on hand and face hygiene, and maintain a distance of 2 yards for social distancing. Now the news in detail. Health Ministry has revised the national policy for admission of COVID patients to various categories of COVID facilities. This patient-centric measure aims to ensure prompt, effective, and comprehensive treatment of patients suffering from COVID-19. As per the same directive to all the states and union territories, requirement of a positive test for COVID-19 virus is not mandatory for admission to a COVID health facility. No patient will be refused services on any count. This includes medications such as oxygen or essential drugs, even if the patient belongs to a different city. No patient shall be refused admission on the ground that they are not able to produce a valid identity card that does not belong to the city where the hospital is located. Admissions to hospital must be based on need. It should be ensured that beds are not occupied by persons who do not need hospitalization. Further discharges should be strictly in accordance with the revised discharge policy. The guidance envisages setting up of COVID care center, dedicated COVID health center, and dedicated COVID hospital. COVID care center shall offer care for mild cases. These hospitals should either be a full hospital or a separate block in a hospital with preferably separate entry and exit. In a major breakthrough against the coronavirus infection, a drug developed by the Defense Research and Development Organization, DRDO, in collaboration with Dr. Reddy's laboratories, got the approval for emergency use by the Drugs Controller General of India, DCGI. The drug 2-deoxy-D-glucose comes in powder form in sachet, which needs to be taken orally by dissolving it in water. It accumulates in the virus-infected cells and prevents virus growth by stopping viral synthesis and energy production. Results of clinical trials have shown that this molecule helps in faster recovery of hospitalized patients and reduces supplemental oxygen dependence. The Phase 3 clinical trial was conducted on 220 patients between December 2020 to March 2021 at 27 COVID hospitals in the country. The detailed data of Phase 3 clinical trials was submitted to DCGI. Prime Minister Narendra Modi is participating in the ongoing meeting of the European Council through virtual medium. The India-EU leaders meeting is being hosted by Prime Minister of Portugal, Antonio Costa. Portugal currently holds the presidency of the Council of the European Union. The heads of state of all the 27 European Union countries are also participating in this meet. AIR correspondent has informed that the leaders are exchanging views on the COVID-19 pandemic and healthcare cooperation, fostering sustainable and inclusive growth, strengthening the India-EU economic partnership, as well as regional and global issues of mutual interest. Today is World Red Cross Day. Nagaland Chief Minister Neiphiu has expressed gratefulness to all the members and volunteers of Red Cross, especially those who are fighting the COVID-19 pandemic. Rio, in a message, lauded the extraordinary reach of the Red Cross to communities of all over the world and its supporting role to governments. The Chief Minister also conveyed his best wishes to them. Meanwhile, Dimapur District Branch of International Red Cross Society has extended greetings on the occasion and also pledged their commitment to help the needy and suffering in times of need. Red Cross Day, also known as Red Crescent Day, marks the birth anniversary of Henry Dunant, the founder of the International Committee of the Red Cross. This news comes to you from All India Radio, Kohima. You can also listen to this news bulletin on our YouTube channel, AIR News Kohima. Along with the rest of the world, Indian Red Cross Society IRCS Zunobda branch today observed World Red Cross Day at the Deputy Commissioner's Conference Hall with the theme Wear Mask to Protect Yourselves and Others and Stop the Spread of COVID-19. Deputy Commissioner and Chairman of IRCS Zunobda branch, Peter Lichamo, said that assistance provided by the Red Cross societies all over the world is highly acknowledged because of the exemplary contributions the society could provide to the needy in times of crisis. Lichamo said the district branch should also prepare itself anticipating the worst effects of COVID-19 pandemic. He appealed to the members to always be ready to make themselves available to the needy, which is the main objective of the organization. Speaking on the theme of the program, CMO Zunobda, Dr. Akado Sema mentioned that India is now entering the third stage of the pandemic, which means that the virus is everywhere and community spread is now inevitable. He regretted that there are still certain sections of the people who advocate against the only practical solutions like wearing of masks, washing of hands, sanitizing and getting vaccinated. He warned that complacency towards the virus could result in mass destruction. Inauguration of coffee bar cum distribution of coffee bulper machines at DPO Office LRT Longling was held with Deputy Commissioner M. Shayungpom as special guest yesterday. Speaking at the program, the DC congratulated the Land Resource Department for coming up with a new coffee bar in the district. He asserted that lack of knowledge about operating the machines would create negative impact on production and urged the farmers to come forward if they have any doubt and learn from the department officials. He also urged all individuals to strictly follow the SOPs guidelines given by the department. He said only very few villagers got vaccinated during the COVID-19 vaccination drive due to lack of cooperation from many villages. Altogether, 25 coffee bulper machines were distributed to beneficiary farmers. Health and Family Welfare Minister Dr. Harsh Vardhan today chaired the 25th Group of Ministers meeting on COVID-19. The meeting reviewed steps to ensure adequate availability of oxygen, therapeutics, diagnostics and medical equipments. The Health Minister expressed concern over the clearing gap between the first dose and the second dose. He said the central government is pursuing aggressively with the states and trying to motivate the people to come forward for the second jab. The centre has designed a streamlined and systematic mechanism for the effective allocation and prompt distribution and delivery of the support supplies received by India in the fight against COVID-19. This will help supplement the medical infrastructure of the tertiary care institutions and recipient states and also strengthen the clinical management capacities for effective clinical management of the hospitalized COVID patients. Union Health Ministry in a statement said that Government of India has been receiving international donations and aid in COVID-19 relief, medical supplies and equipments since 27 April from different countries and organizations. The ministry said cumulatively 6,608 oxygen concentrators, 3,856 oxygen cylinders, 14 oxygen generation plants, 4,330 ventilators, about 3 lakh remdesivir vials were delivered so far. The ministry said a dedicated coordination cell has been created to coordinate the receipt and allocation of foreign COVID relief material as grants, aid and donations. And now 20 news, here are the main points again. Health Ministry revises national policy for admission of COVID patients to various categories of COVID facilities. Drugs Controller General of India approves drug developed by DRDO for emergency use in treatment of COVID-19 patients. Prime Minister Narendra Modi participates in a meeting of the European Council. And Nagaland Chief Minister Neiphiu expresses gratefulness to the Red Cross members and volunteers, especially those fighting COVID-19 pandemic. That is all we have in this evening news bulletin. Good night.